Hi, everybody. First off, I would like to thank the 3 BA students for their aging-focused presentations. It kind of makes my project seem a little bit less of an oddball topic, so I really appreciate that. So my name's Cara Pearson, and I'm going to talk about the scoping review I did on health promotion in palliative care. I'll start with a couple definitions. We probably are familiar with the health promotion definition, but it's important to remember that health is a resource for everyday life, and therefore health promotion helps people enables them to have control over their health and to be able to cope with their environment. And it's important to note, for the purposes of this presentation, that it's not just the responsibility of the healthcare sector. And for palliative care, I'm just focusing on parts of the definition that are most applicable to health promotion. So palliative care relieves all kinds of suffering, and it is applicable throughout the course of the illness from diagnosis onwards, and it supports patients and families. And it's a common misconception that palliative care is just something you get at the end of life. But as you can see, it's part of the definition that it is appropriate throughout the course of the illness to relieve suffering. And it's also really interesting to note that both health promotion and palliative care came about because both of those fields thought that health had been over-medicalized. So it was different approaches to address that. Too soon. And so I tried to draw some arrows, which you just saw, between the two terms to try to connect the parts of the definitions that I could see connections between. And this is what I came up with. It's a lot of arrows. So my point is that these are related concepts. Okay, so the aim of my scoping review, I thought this was a really good quote that illustrated the reason I wanted to do this. Seriously ill people still qualify as members of the public, and so the offerings of public health, including the promise and support of health promotion, are legitimately theirs also. And my research question: what information does the peer-reviewed literature contain that describes palliative and end-of-life care as opportunities for health promotion? I started out with a wider scope, but it was just too big for the time I had. And I'm just going to go through my methods really quickly so that I have more time for the findings. So I started with search terms relevant to health promotion and palliative care. And I searched 5 databases and 22 key journals, applied inclusion and exclusion criteria, and then the articles that I ended up with, I hand-searched all their reference lists and to identify some additional articles that the search has missed. And this just illustrates my process. And you can see I ended up with 36 articles. And then I analyzed them for themes and wrote up my report. So the results. For the 36 articles, I found 4 main themes, and each of these themes had 2 sub-themes. So I'll talk about those a little bit more in the next slides. Something interesting I found is that the articles, partly because they were mainly from a public health perspective, they talked about all of these issues related to serious illness, end of life, dying, bereavement, but they weren't really specific about which particular issues they're talking about. So at least in terms of health promotion, it's maybe appropriate to think of these things as kind of more of a continuum, not a progression from one to the next to the next. And also important that these issues involve the family and community, not just the patient. Okay, the first theme, health promotion over the life course. This is the one that really connects health promotion and palliative care. And it highlights the possibility of health promotion even in the presence of illness. So my third point there, I've got another quote that I really liked. The dying are not the dead. To me, that means they're not dead yet. So therefore, they still have health. So therefore, health promotion is applicable. And at this stage of life, tertiary prevention is a form of health promotion, which means that the person could be receiving treatment for their illness, but you're also trying to prevent their health from deteriorating farther if you can avoid it. And then extending health promotion right to the end of life, promoting a good death. So we might want to ask ourselves, when exactly is a person dying? It's hard to tell sometimes. Is it when they're diagnosed with a terminal illness? Is it when they're actually actively dying and they're in their last few days of weeks of life, somewhere in the middle? So an example of this is dementia. Dementia is actually a terminal illness, but you would never think that someone who's just been diagnosed with dementia is dying. So that underscores the importance of providing support for people at whatever stage they're at in the course of their illness, right to the end of their lives. Okay. Second theme. It highlights that serious illness and end of life are actually social experiences. And recall what I said, that the mainstream healthcare system has, in some people's views, over-medicalized health and wellness. So interpersonal social support is really important. It can help reduce isolation, increase quality of life, and improve communication. And informal caregivers, such as family members, actually provide the most care that a person receives compared to receiving care from professional care providers. So it's really, the family caregivers especially, they're indispensable to the healthcare system. They provide such an important contribution that they also need to be supported so they don't burn out, so they can continue to provide that care. We could never afford to pay for all the care they provide. Okay, and then the community is also a really important place of social support. People spend most of their lives in their communities as compared to in the presence of healthcare service providers. So it's really important that those communities are supportive places to be. And getting as much of the community involved as possible can help to create a continuous background level of support for people where they spend their time. Okay, theme 3, sharing information and working together. So collaboration is really important to promoting health within palliative care, within serious illness and end-of-life issues. So this involves building the capacity of communities to be those supportive environments that we want them to be. And in terms of healthcare, from a healthcare perspective, there's a difference between working in the community, which is treating the community as a location to provide your service, and working with the community, which is much more collaborative, and it gives the community a voice over the types of services that are available to them, and in planning and decision making. And this was a really prominent theme that I found, communication and education, particularly building a public dialogue around serious illness, dying, bereavement. These are really taboo subjects that people don't like to talk about. And when people don't talk about them, there can be misinformation, there can be stigma, people can become isolated if they're experiencing those issues. And talking about them more will build openness, inclusiveness, it will normalize these issues, so people will not be so marginalized within their communities. And it will also help people better prepare for when that time comes in their own life, and also to be able to support their loved ones. Okay, and the fourth theme is, surprisingly, I actually found it to be the smallest theme in my search. So the first thing to note is that the healthcare environment is changing because we have an aging population, we have increases in chronic disease, and people are also demanding higher quality services. But it may be difficult to meet this demand due to budget cuts, and therefore services have to be prioritized or access is limited in some way to make them more affordable to deliver. And then quality improvement. This is not a straightforward issue. So But applying it to chronic illness, given the demographic changes, will help to meet the care needs of more people. And here I'll just note that upstream means earlier in the course of the disease, which is a bit different than we usually use that term in public health. And because this was a research project, I wanted to just highlight some implications for practice. For public health, it's really important to recognize that serious illness and death are universal experiences, which makes them public health issues and deserves public health attention. And then once this is acknowledged, public health can make a really good contribution to building public dialogue and normalizing these issues and building support around them. On the healthcare services side, it's really important to integrate a more holistic view of health, not just the physical aspects of health, and then integrate that into the care that they deliver. And this would give a better picture of how people cope on a day-to-day basis. And I had a few more slides, but I'm out of time, so I'm just going to skip through them. References, acknowledgements. So first off, I just wanted to thank my supervisor, Kelly. She is here. She came to watch. She's my practicum supervisor and also my work supervisor, and she was very supportive. My first and second readers, and then everybody else in my core work team who were there for me when I needed them. Thank you.
Thank you so much, Cara. That was a lot of material. My goodness, my gracious. So, questions, comments?
Thank you, and I think that fits very well with the other presentations earlier about aging and dying. And what comes to mind for me, I'm just finishing Being Mortal, which is a book about aging and dying and how we view that in our society. And I was wondering if you could comment on what you think the single greatest change we could deliver to these patients would be in terms of the way we provide service to those in a palliative situation.
So from a health services perspective?
From a health services perspective.
You want just one? Okay, well, I would say probably working with the communities more to, that's for several reasons. So it's to help inform the communities about the services that currently exist, because people, they've heard the word hospice, but a lot of people don't know what that actually is, and whether or not it would be helpful. And then also to get feedback on the services that are currently delivered. So are there access difficulties? Do we need to provide more of one type of service and less, probably not less of another type of service, but where are the greatest needs?
Thanks, Cara. So I'm going to confess, I was one of those people that you got when I read your paper who didn't quite get it initially. And you said, some people might think it really kind of strange to talk about health promotion and palliative care. And let me tell you why that's important. And so I really found reading your paper really quite exciting and very interesting. Good. So I guess my comment and question really is, it seems to me that in a way, there's another side to this that could be explored in more detail, and that is the knock-on effects of having a compassionate, honest, reflective conversation with a person that is loved or that is loved by someone who is going to still be alive, and the opportunities that are there to mend fences, to make repair, to make claims about life together, things that work, things that didn't, and give the opportunity for, after a person dies, the people who are left to reflect on a life and not just be angry about things that weren't said or ways in which things didn't get stated, fences left unmended and so forth. I'd be interested in hearing your comments about that and how that might factor into this project of health promotion in the context of palliative care.
Definitely, and that did come up in the scoping review. Unfortunately, it didn't make the 10-minute cut for this presentation. There was a lot that didn't make the 10-minute cut. And that, I filed that under the interpersonal social supports theme. And that, it's not just the support between the ill person and their close social circle, but it's also interpersonal supports with the healthcare providers. And the healthcare providers can help to facilitate those conversations, to help improve relationships, and to help improve communication skills within the families so that they're satisfied with the services they're receiving, but that it can also help to resolve mend fences, like you said. And it's important to note that the palliative care is interdisciplinary, so it's not just doctors and nurses. Social workers are also key members of the palliative care team. And spirituality is also another really important factor that plays in at when people have serious illness at the end of life. So, and any other types of support around any type of suffering is considered palliative care.
That's the button. I think we have time for either one longer question or two quick questions.
Cara, thank you. This is kind of along the lines of what Michael was saying as well, as I was thinking of people with dementia and how that progresses, and the mending the fences before the dementia gets to the point where the person really is not aware. And I'm thinking of even folks in our neighborhood where there have been a couple of people who initially they were okay and the fences could have been mended, and then the personality changes to something that they never were before. So more of a comment, if you have anything to say, that would be lovely to hear you say it.
Well, I think, so applying palliative care to chronic illness means any type of chronic illness. Dementia is one. Chronic, advancing, life-limiting, all those words. And a part of palliative care is supporting a person where they're at in their illness and also planning for the future. So with dementia in mind, knowing what might happen in the future, having the providers help the family to plan for what might happen in the future and to get things in line would definitely be relevant there.
I think that is all that we have time for. Thank you very much, Cara. I really appreciate it.